Testicular torsion is the topic, and testicular torsion is essentially a rather severe consequence. It's an emergency, and the person can lose the testicle if this is not urgently treated. So you've got a very short window, less than 6 hours. Essentially what's happened is there is a rotation of the testicle, and there's a consequence of strangulation of its blood supply. And this can happen most commonly in males ages 12 to 18. It sometimes can happen in a 20-year-old person in their 20s, but very rare after the age of 30. So what are the symptoms? Well, definitely severe pain. That will be the presenting complaint. Patient will also have nausea and vomiting. There will be some swelling. And the testicle can also appear horizontal, and in addition can also be elevated. Now there's two physical exam findings that are very characteristic, and the first one is a loss of a cremasteric reflex. The cremasteric reflex is essentially you stroke the inner thigh, and normally there is a contraction of that cremasteric muscle, and that pulls up the testicle. And this reflex will be lost in testicular torsion. Another thing that is lost is the Prenz sign. Now, what's Prenz sign? The Prenz sign is a very easy physical exam. Essentially what you're doing is you're elevating the testicle and see if the pain is relieved. In testicular torsion, the pain is not relieved. So that's a very easy thing that you can do during the physical exam. The pain would be relieved if it was epididymitis. So it's a way of distinguishing testicular torsion from epididymitis. So how do you diagnose this? Basically just clinical, based on symptoms and physical exam. But there is one test that you can do, and that is a color Doppler ultrasound. And that ultrasound is essentially done to evaluate the blood flow to the testicle. Now the treatment of this is done urgently because if you don't, you can get necrosis and loss of the testicle. The first thing that you can do is just try to see if you can manually detorsion the testes, and if that is unsuccessful, then you have to go in and do it surgically. So let's take a look at a couple clinical vignettes. A previously healthy 15-year-old boy is brought to the emergency department with a 3-hour history of right testicular pain. He states that the pain began after football practice this afternoon. He does not remember any trauma to the area during practice. He appears to be in significant amount of pain. Blood pressure is 128, pulse is 110. Physical exam shows erythematous swollen right scrotum with a significant tenderness to the palpation on that side. You also note that the cremasteric reflex is absent on the right side. A UA was sent from triage and is negative. Most appropriate next step is, well, this is a classic case of testicular torsion, and without a doubt, immediately you should get a surgical consultation and try to get this fixed surgically. One more question. 27-year-old man comes to the emergency department because of exquisitely painful scrotum. He says that when he was walking to lunch with friends, the pain hit him like a thunderclap. He states that he has a steady girlfriend and they have been active. He is very healthy, never experienced pain like this before. He regularly checks himself there, and that young comedian underwent testicular surgery on television. His temperature is 98, blood pressure is 130, pulse is 86, respirations are 19. Physical exam shows severe scrotal tenderness that is not relieved when the scrotum is elevated. Prince sign. The right testes is higher in the scrotum and riding in horizontal position. The cord above the testes is not tender. UA shows this result with bacteria absent. Next step is 2. Well, they've given you a lot of good hints here. Testes is elevated. It's in horizontal position. You've got this negative Prince sign, so there's no doubt that he's got testicular torsion. And again, the treatment is almost always the same on clinical vignettes. They want you to urgently get a surgical consultation, and that would be, in this question, choice E. A urologist basically will be the one to call, urologist or a surgeon.